everyone. Welcome to Momstar Series. So today we have Mrs. Archana with us. Happens to be my college junior and a loving junior with me. So it was an awesome thing to have connected with her with a common goal, which we have always been working on women health. And then we got a chance to connect to each other after a cute Chotu baby was born, which is right now you can see in the video. So welcome, Archana.
Thank you, Dr. Tanima.
So, Archana, please tell us in brief about yourself.
So, as Dr. Tanima mentioned, I was her junior. So, I'm a doctor. I'm an Ayurvedic physician, and currently I'm living in US. I practice over here. I have two kids. One is 6 year old, and this one is 5 months old. So that's all I have to tell for now.
You can also tell about yourself, what you are doing and what you're planning to do a little about yourself.
Okay, so my plan is to expand, like what Dr. Tanima is doing over in India. So I have like similar plans. So I also want to like expand my this thing expertise in women's health, basically for postnatal care and then for neonatal care. And I have made out some plan. Just waiting for this guy to get up, like for him to grow a little bit, and then I hope if everything is fine, I might open a center, and that center is basically will be dealing with postnatal mothers and neonatal babies.
That's great. All the best in advance.
Thank you so much.
I know that
Thank you so much. Thank you so much.
you're going to do an awesome thing and make us all proud of you.
You being my guide, I am very sure I'll do my job perfectly.
My pleasure, Bache.
Thank you.
So, my second question is, what was your biggest challenge in breastfeeding journey?
So with my first kid, I think I was kind of ignorant. I didn't knew breastfeeding would have been such a challenging job for me. But with this second kid and due to Corona, I was all alone. Like nobody could come from India to help me out. So I was not with him. The biggest challenge was that he was only stuck on one side of the breast. He wasn't going for the right side feeding. He was more prone towards the left side feeding. And then he wasn't feeding enough. And then I think he was hungry. And I couldn't knew okay, what's happening with him. So that was my biggest challenge, that he was only like concentrating on one side of the breast and then not feeding properly. And then if I had to push him hard, he would just refuse.
Hmm. Okay.
Yeah.
So his weight gain was okay or it was lacking also?
No, I think it was lacking. He was towards like the lower side of the weight percentile.
Okay. Because
Yeah.
feeding from one side won't be enough for him, na?
Yeah.
Okay. So share your breastfeeding journey with us.
So I thought I knew everything. And I was like,
As all
I'm
mothers
doing
say.
my perfect job. Then my husband was like, why don't you connect to your senior? She's an expert in this. I was like, okay. Then 4 a.m. in the morning, she called me and I called her, and then I called Dr. Tanema, and then when she told me like whatever ways I was breastfeeding Abhyuday, it was all incorrect. I wasn't latching him properly. I was not cuddling him properly. And then she told, like, I mean, you told me like how to take towards the other side of the breast, take like, so that he can feed more staying nicely, and then his tummy gets full. So I would say all thanks to you, because I mean, I didn't knew that I had so many this thing shortcomings in breastfeeding my this little one. So with all your guidance, I could feed him more. I could see the weight gain in him, and I would say that it was just because of you. I could able to manage my this journey of breastfeeding with this kid. I'm still continuing breastfeeding him.
You know, the best part of thing when you counsel anybody, any mother, because you have that same feeling for everyone that every mother should be exclusively breastfeeding. But
Right.
the most wonderful thing is to see a mother and a baby both happy. Like I can see Abhyuday right now, just
I
enjoy.
know, I know, I know.
So that is the best thing to see, and I really feel so blessed to have mothers like you in my whole tribe who are just so passionate about breastfeeding, and then also further, like it is not stopping there. They just want to just move ahead and educate everyone, and which is my, and I feel that both of us, because being doctors, we understand that, and we will be doing like continuing this kind of journey with everyone and most of the mothers.
And you know what? One more thing I forgot to add, that with your guidance and your tips and tricks, uh, even the quality and quantity of milk got increased. Because initially I was you know what mistake I was doing. I wasn't feeding him on time. You know, I was just, because he was not hungry, he wasn't taking enough feeds, and I was just giving a lot of breaks. So probably because of that, my milk supply was declining.
Hmm.
And then when you told me that you have to
So he
feed him
wants
like
to go back. I think he wants to
yeah,
get back. Yes.
and then when you told me that you have to feed him regularly for every 2 hours,
Hmm.
whether he is hungry or not, you have to like bring him to your breast. So that's what then I accepted it, and then I started doing it. And then you told me some formulations also, that you have to take that morning and evening. I started that too, and I could see the difference that my all of a sudden my milk supply, the quantity and quality, both of them got increased. And then I didn't knew the concept of the hind milk and the fore milk. So that was something which I learned from you, which actually like made his weight gain.
Hmm. And moreover, because you are outside India, so I was just having that challenge that how will I help her? But when you gave me a good news that it is going fine, I was so relieved, because I was just thinking, how will I help her? Because you are staying outside, like in outside
Yeah.
India. So, well, but I just see that you have been so consistently and following also. I guide every mother. It is not like I have any kind of any personal things that I should tell this or not. But it is all the mother also to listen things and work on that properly. So I would always give that credit to the mother also who listens and follows that. So hats off to you for that also.
No, I had to, because I had to breastfeed him, because that's the nutritious thing which you can offer your baby. Once he'll grow, I mean, after 1 year, he'll be eating everything. So
Hmm.
you know the benefits of breastfeeding and the breast milk, and that is why I wanted to continue that.
Yes.
And yeah, with your guidance, I was successful.
Yes, Archana. Actually, here I would like to add one thing. Actually, everybody knows that breast milk is the best, but sometimes it is either lack of guidance or sometimes the lack of motivation also. Both the things are also there into
Yeah,
this.
yeah.
Because sometimes if you are not properly guided into that, or you lose your motivation into that, or something happens which makes you feel that I can't do that, then also the things start going down. That is also
Yeah, I
I
mean, a
felt it.
mother needs a continuous support, because she's
Yes.
already going through so much of, hormonal changes and stuff. And when then this breastfeeding issue arises, she kinds of feel like I'm not able to provide enough nutrition to my baby. So this kind of gives her, kind of feeling of a depression. And that's where counseling comes, like the way you counsel and you motivate mothers, and I was motivated. So I mean, I am the biggest example, because I got through all of your experience, and I could now vouch for that you're just awesome.
Thank you, Archana, for that.
You are
For your
welcome.
lovely words.
No, no,
Okay,
no, no, you deserve that.
okay, thank you. So I think I can skip my fourth question because you already said so many things. So I'm coming to my fifth question. What message you want to give to expectant mothers? First, I would like to ask you about the expectant mothers.
Okay, so the expecting mothers, I would say they have the biggest issue, that will they be able to feed their child properly? Will
They
they
do.
be
They
able?
don't have. Usually, I see the pregnant ladies. They just think that breastfeeding is a natural thing. It will come. It all by itself. And they're just working on either how can I get a normal delivery done, or what all things I should learn in pregnancy, etc. But I
Yeah,
see most of them. They just think breastfeeding will come natural.
they take
So
it very casually, but once
yes,
you start breastfeeding a kid,
yes.
there where your
So true.
challenges arises.
Hmm, hmm,
Yeah,
hmm.
there where your challenges arises. there when you realize, okay, I mean, I'm the biggest example. Like with Agastya, I didn't have any problem. But with Abhyuday, my goodness, he was a challenge. He was not ready to breastfeed. And
Hmm.
then, and then he told me like how to, bring him, and then how to just the close contact and everything. And then like he became easy and then started feeding from my breast.
So that's what I want to ask you one thing, that what piece of advice you would like to give a pregnant lady about breastfeeding?
So the piece of advice I would like to, first of all, the pregnant lady, right? Not the mothers,
Yes,
the one who is
yes.
expecting, that they should not think that, okay, I am, if my baby doesn't breastfeed, I'm going to go on other alternatives. I would say the breastfeeding is something which you can offer as a mother,
Hmm.
and that's the only thing you can offer which is beneficial for your baby. Be it for 6 months or a year, just don't get disheartened and take it as a something like, as a mother only you can do. So
Hmm.
for a mother, I think this is something which is none of, not even a father or other people can do. So it's something you have been gifted. Take it as a gift and nourish your kid with that.
Yes. And
Yeah.
what is the piece of advice, or what kind of uh, like message you want to give to the new mothers, to the fellow mothers?
I would say if you have any issues with breastfeeding, don't get disheartened. Just go to a proper channel, go to a proper person, go to a proper counselor. For me, it's like Dr. Tanima right now. And you need counseling, you need motivation, because we think we are doing a right job, but somewhere we are wrong, incorrect. Especially like I was latching him not correctly.
Hmm.
I was thinking he's taking proper latch, but he wasn't. So you need counseling, you need advice, you need someone to instruct you, and if an expertise is there to guide you, nothing can beat that.
Hmm.
And I would say, like, for me, you have been a blessing, because I was all alone, and I was really, really, kind of going into depression, that I fed my first kid like exclusively. He was breastfeed fed.
Hi.
He's here
Hi,
for,
Agastya.
for 18 months, I would say, and I couldn't like provide nutrition to him like for even 6 months. So I was getting kind of getting disappointed, and that's where you took my role, and then you just guided me, and I went nicely. Okay.
So, August, we don't have a good morning right now in India. It's there with you, good morning. For us, it is
Yes,
good
yes,
night.
say good night, Dr. Tanima.
Masi, you have to say me Masi.
Good
Masi. In fact, I would
night.
branding. I am just branding again Masi.
I know, I know, I know.
Okay. So, Ashna, that is a great thing. And I would also let my viewers just tell that now the baby is going to complete 6 months, and both
Yes,
of them are going strong on breastfeeding. And
yes, yes, yes,
very soon we will be starting our complementary feeding journey together,
yes,
and
yes.
some mixes are on the way. So,
I know they are coming for me.
so I would like to tell my viewers that right now Ashna is in US, and her husband has come for a wedding in India. So he will be traveling very soon
And
back to
he will
the
be bringing
US.
all my packages.
Yes. So we will be starting a complementary feeding, a healthy way, how that should be done for babies after 6 months. No watery food, no dal ka pani, chawal ka pani, and mashed banana and suji kheer. Please, no, 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 absolutely no to all
Yes,
that. And I'll be guiding you all properly. So about
thank
all
you.
complementary feeding, that what you should give, and maintain his good weight and
I'm
his
looking
height also.
forward for that. Yeah.
Yes,
Arrested.
and
Good.
we always just concern about the weight, but we don't take the height and the length of the baby. So I want you to take that also, so
I
that
will do that.
baby's length is also properly measured, and we
Yes.
are taking good care of that also.
Right, right.
So thank you so much, Ashna,
Thank you so
and
much, Dr. Tanema.
and first of all, I would like to say a big thank you, because I know right now you are all alone with these two munchkins. So you took that time with to just come here and share your experiences with me. So that is a great thing. Thank you so much.
Thank you
So
so much, Dr. Tanema. You have been a big help, and still you are guiding me.
yes, that is my my job also, and since you are my junior also, so there is some personal
Bonding.
connection
I mean,
also.
you've
Yes,
always been my
yeah.
favorite one, na? So I kind of, didn't
Now,
hesitate in asking
now
stuff.
you are live. You can't say you are my favorite one. See, you are going live right now.
Oh, okay. No, but you are. You have always been, and that's why I trusted you, right?
Yeah,
Otherwise, I wouldn't have.
true, true.
Yeah.
Okay, take care, Ashna. We are just ending this
Thank you
session.
so much. Thank you
Right?
so much, Aditya.